Hello, good afternoon and welcome. Welcome to today's Tech Tuesday, and thank you to so many of you for joining us for this rapidly developing technology sector from industry, academia and stakeholder investment communities. For the housekeeping today, we have a time set of 75 minutes maximum running time. So in this time, you'll see 3 presentations and then we open the Q&A to close. Please use the chat channel to position questions you have for any of our speakers, which we'll select from after the 3rd presentation. We make no apologies whatsoever in delivering 3 presentations today because the combination, breadth, and perspective from all 3 keynotes will combine to position the future technology and societal value this emerging marketplace offers. So for today's Tech Tuesday topic, we wanted to offer both a strategic overview alongside real-world tech solutions and product developments in this arena, and for multi-level users and providers. We'll hear from the perspective of industry partner positioning, need for this specific technology, versus the immense challenge of societal care costs and the impact and role digital tech can address both today and into the future. Digital transformation in healthcare is the positive impact of technology. Here's why telemedicine, artificial intelligence, AI-enabled medical devices, and blockchain electronic health records, to name a few, are just a few concrete examples of digital transformation in healthcare, which are completely reshaping how we interact with health professionals, how our data is shared among providers, and how decisions are made about our treatment plans and health outcomes. Innovation is the name of the game here, with the main goal of streamlining physicians' work, optimizing systems, improving patient outcomes, reducing human error, and lowering costs through amazing web and mobile experiences. By 2030, the leading medical device players will be those that play an active role in delivering value by connecting with customers, patients, and consumers, the end user. This will require a shift from treatment and cure to prevention through integrated smart services and solutions that bring down the cost of care and improve outcomes. Technology will have a significant impact, resulting in prevention and, if still necessary, highly efficient, minimally invasive treatment options that decrease the time spent in hospital. Medical device companies will need to carefully evaluate their business and operating models in order to deliver value beyond the device in 2030. So from the top line, let's relate this to the BetaDen ecosystem and how Worcestershire Remote Medicine and Assistive Technology Network is progressing. I'm Linda Smith, I'm CEO and founder of BetaDen, and today I'm delighted to set the scene for today's topic by firstly welcoming Mike Emery, the Director of Digital Health from NHS Herefordshire and Worcestershire, followed by 2 locally based figureheads to talk about their product, positioning and development, and how these solutions and services are addressing different aspects of this critical market, whilst considering both the societal need and cost benefits through technologies being developed for market. So here first, as I said, is Mike Emery opening the session today for BetaDen, and Mike's presentation titled Vision for the Future and Opportunities for Industry Partners. Welcome, Mike, and over to you. Thank you.
Thank you, Linda. Hopefully everybody can hear me, and if I've requested remote control, so I'm hoping we can move on to the relevant slides. Brilliant, that's great. Well, it's a huge pleasure to be here this morning, this afternoon, to talk about the opportunities for industry partners in the area of remote care and assistive technologies. I'm very much here to set the scene and to outline where those opportunities may be for many industry partners and some of the challenges we're currently facing in the healthcare sector that these solutions that you will hear about later could respond to, and some of the challenges we're facing, which over the last 12 months has been very evident and been right at the forefront of a lot of the challenges we faced, if you like, during this very difficult time and the COVID pandemic. For those of you that I haven't met, my name is Mike Emery. I'm the Director of Digital Health, as Linda said, for NHS Herefordshire and Worcestershire. And in particular, I'm the Chief, if you like, the Chief Information Officer for what we call our integrated care system. First, very briefly, what is an integrated care system? If we just try and move the slides on. Not having much luck here, I'm afraid. The integrated, apologies everyone, I think there's a slight time delay between my computer in the wilds of Herefordshire and just go back to this slide. So the integrated care system is in essence a partnership of all the health and care bodies within Herefordshire and Worcestershire. There are another 40 of these replicated across England and Wales. It's a partnership of, if you like, the acute trust, the big two acute in Hereford and Worcestershire, the Herefordshire and Worcestershire Health and Care Trust to provide mental health and community services. The two local authorities play a role along with partnerships with the community and voluntary sector. We're responsible for, depending on how you cut it, between 1.5 billion to 2 billion pounds worth of spend in health and care services, covering 100,000 people across the two counties. And actually our workforce is huge. We place a significant role within the local economy, about 18,000 directly employed, but there are additional ancillary workforce with regards to the independent sector and other support services. I think our vision very much, like many other health and care systems, is about enabling better care and improving people's lives. But what we're putting a big push on is around that digital transformation agenda and how that can make a difference to how we deliver services. So what are the challenges we face across health and care? Well, in a nutshell, the challenges we face revolve around an ageing population with that have increasing comorbidities across the system. This is largely due to rising activity, and it's putting immense pressure on the current health and care system. You would have heard today there's lots of conversations around how we fund it and support it more broadly. And work is ongoing around that currently nationally. On other governance, more broadly, we have to work through how we balance budgets. There's an increasingly overstretched infrastructure and health workforce, which has only been exacerbated by COVID. And there are increasing expectations from consumers and patients around responsiveness. People increasingly these days with the digital agenda expect that 24-hour response very rapidly. I'm now going to, I think we're having one or two challenges with this slide. Slide 4 of my slides is focused on how potentially we can do things differently. And I don't know if Helen can take control perhaps and move to slide 4. I seem to be having trouble from my end. Apologies, everyone. We seem to. So, how can we do things differently? If I plough on, we will see if we can work with the slide. I think one of the ways we can do things differently is around remote care and assistive technologies. If you look at the opportunities we can consider, we can deploy technology to help people to live more independently by vital signs tracking. Helen, we're on slide 6 with the blue squares. And that would allow people to live independently and to have care away from hospital settings. There may be ways that we can support people to manage their health care around long-term conditions, for example, diabetes and COPD. information from vital signs monitoring can go straight back to clinicians who can then use that information to inform the clinical decision making. Importantly, we can do far more away from out of hospital settings around pre-operative assessments, so there's less pressure on bedded care in hospitals. We can do those assessments away from the hospital, so when people come back into the acute setting, they're able to almost immediately go through into their procedure. And the same with rehabilitation, trying to get people out of that hospital setting as quickly as possible and release the pressure on beds. I think the other key thing we can think about assistive technologies potentially in the future is also tackling some of the issues around social isolation and things like companion robots, or connecting people across different communities. So Edith, if you like, a village in Worcestershire, could talk with her friend up the road in Upton and Severn that she may not be able to travel to, but if you think of things like Facebook portals, she'll be able to talk to her friend using that kind of technology, which really starts to connect people. So what we're trying to do in introducing assistive technologies is a range of those tasks and ideas you can see on the slide here that ultimately lead to reductions in hospital admissions, improving information for clinicians to improve decision making around what care is required for them, and allowing people to stay more informed about their own health long term, which allows them to support the management of their care needs. And importantly, with all these things in the public sector, we can also use this information to reduce treatment costs. So if we go to the next slide, I just briefly wanted to talk about smart hospitals. I've talked about assistive technology, but I think there is wider potential as well around all of this about how we better connect things within hospitals, which includes remote monitoring as well, and the use of the Internet of Things, as well as the potential to do automated delivery and like. I think one of the challenges we've got in Hereford and Worcester, though, is the challenge of connectivity. I've had numerous conversations with colleagues nationally how this is often not considered a challenge if you live in the big urban centres, but for us it's really key. And actually we are trying to resolve some of these by doing some test beds, for example, in Malvern and Tenbury around 5G to see the added value that improved and enhanced connectivity gives us. So if we move on to the next slide very quickly, why should you be interested in the industry sector? Well, I think Linda already mentioned some of this, but it really is one of the fastest growing global sectors in the world, digital health tech. Some figures talk about 4 or 5 fold increase in the next 3 to 4 years as an industry sector. And if you think you can start to, if we use Hereford and Worcester as a test bed, you solve some of these issues in Hereford and Worcester trial technology, that's globally applicable to places like India, China and Africa, huge markets that the industry sector can take account of. I think the other thing that I would push around economic development is by solving and supporting people with long-term conditions. We're trying to reduce the impact of ill health on the economy. Some analysis we did 2 or 3 years ago said that the impact of chronic heart disease, not health disease, and COPD is something like £280 million per annum for the Hereford and Worcester economy. So you can see this is an area that we should all be invested in to try and solve. And we want industry to take, local industry to build on this. We want to attract the talent to Hereford and Worcester. It's a lovely place to live, so why shouldn't we promote Hereford and Worcester as an area we can test some of the talent technology and trial different things. And as I said, we are being noticed. We've got some testbed pilots in Malvern and Tenbury that industry can potentially use in the future to trial some of these technologies and the advantages of connectivity. So if we put all that in place, what are some of the exciting things we can look at potentially in the future? So a couple of very quick examples, and I know you're going to have some specifics in the two presentations. So the next slide talks about telemedicine, the ability in the future via good connectivity, things may be able to be done remotely. You can work with clinicians, excitingly, around holograms or polymedicine to train people and also to help diagnose people. And we're also doing some work around remote physiotherapy with various devices. So there's a lot out there we can do and could do over a significant distance. And then the next one, just quickly, we talk a lot about artificial intelligence. If we're collecting the information, then we can use that to inform clinicians' diagnosis and decisions. And for example, by taking that early information, it allows us to notify or prevent people's, if you like, deterioration and admissions into hospital. And so the more information we get and collect remotely, that helps us with that preventative work that we've already referred to, but also allows us to support individuals to manage their own health. So the very last slide, I have a phrase that I use a lot from Steve Jobs. So we talked about the artificial intelligence slide. So the very last slide that talked about Steve Jobs, about how why this is exciting. I think if we engage people and work with people, this is a really exciting agenda, and I'm talking about putting the ding into the universe. And I think if we can create a community of practice, there's a lot we can do to really deliver healthcare differently, working with industry partners. And from a personal perspective, I've seen the ability of assistive technology make a real difference. I have a daughter who's autism and non-verbal with epilepsy. We use a tracker to identify when she pretended her vital signs could be moving her towards a seizure. But it also allows her, we've got a talker that she uses to allow her to communicate in a far more independent way. So there's the wider industry sector, but when you see the difference it makes to an individual, I really think it's an exciting agenda, an exciting prospect of what we can do about remote monitoring. And I know the two presentations that follow will give you two specific examples. Apologies for the few challenges with the slides at the start, but hopefully that gives you an overview of the things we could do in the future.
Thanks very much, Mike. And as I said, apologies. I do think it is to do with your location Wi-Fi. I really, as I said, to our joiners today, our registrants, really nothing we could do about that. So sorry, it was a slight echo on that, Mike, but I hope, as I said, strong slides and very, very relevant to the next two presentations you're going to hopefully listen to without the echo. So thank you very much, Mike, for, should we say, that overview and very kind of personalised end to that presentation as well. So next up, you're going to hear from Rupert Lawrence. If we can have the slides swapped over, guys, on the management of that. So Rupert Lawrence is the former head of Amica 24 and non-executive director for England at the Tech Services Association, TSA. Amica 24 is a leading provider of technology-enabled domiciliary care services, talking about tech journey moving from traditional telecare model to create embedded innovative solution for technology-enabled care. Rupert's presentation today, and I think you're really going to enjoy this, is entitled Journey to Technology Embedded Care. Keep some questions start flowing, or should we say where your thoughts are leading. Don't forget to use the chat channel. And as I said, we're really interested in quite a mixed audience today from industry, academia and stakeholder management. So again, questions for any of our speakers, please feel free to use the chat channel, which we'll get to at Q&A. In the meantime, if I can hand over to Rupert, please, if you could take your presentation forward for our audience. Thank you very much.
Thanks, Linda, thank you for inviting me to speak here today. I'm really excited to share some of the details of the tremendous work that has been going on over the last 6 years in Worcestershire around technology-enabled care, and really want to be able to share our journey to that end over that period of time, and highlight some of the opportunities for technology. There's some great suppliers out there with great ideas, and I'm going to touch a bit later on about our work with specific suppliers and things. And you're actually going to see a great example in the next presentation of a wonderful technology being demonstrated, a technology that I have experience of, and as Mike pointed out, the difference that these technologies can make to people's lives are absolutely immense, and seeing the real people impacts of these technologies is really something special. I think after Mike's experience with the slides, I think sometimes we all always ask ourselves, who would work with technology? We question it sometimes, but the technology has really worked in Worcestershire around that. So hopefully it's going to work for me, he says confidently. Right, okay, the next slide is not moving on for me. Apologies, everyone.
Okay, but you have host control. So can I come to Helen as host on this? Have you been handed over host control?
Yeah. That's it, thank you. So just very briefly about me. So the last 6 years I've been head of Amica 24, which was formerly Worcestershire Telecare. I'm moving to a more national kind of focus with my work going forwards, but my primary focus has been working within Worcestershire and helping to transform the delivery of assistive technology-based services across the county. It's been a really, really exciting time. And from that work, I've actually started to work at a national level with the Tech Services Association. I was elected Director for England in 2019. And that's been a really great profile raise for the work in Worcestershire, and it's really recognised as one of the leading examples of best practice around technology-enabled care. So that's been fantastic. Next slide, please. So what I'm going to present on today is just a bit of background around that migration, that journey from a basic assistive technology telecare type service through to how you deliver effective technology-enabled care, how we worked with the local authority here in Worcestershire to really transform the way that packages of care were designed and delivered, and really putting technology at the heart of those, and really talk about how there's so many opportunities for technology. Mike was talking around the impacts and costs around particular conditions and disabilities and things, and really wanted to highlight some of the excellent work that we were able to do to help people living with some really quite complex needs, and really overcoming some of those challenges. And I'm also going to touch at the end about what does the future hold for assistive technology, and that hopefully give our delegates today some insight into the opportunities for products and solutions. Next slide, please. So arriving in Worcestershire in September 2015, I previously worked in Herefordshire around similar type of service. What I encountered at what was known as Worcestershire Telecare at that point was a pretty traditional telecare service here, and a county where there was fairly limited uptake of assistive technology, very much analog based. simple alarm and pendant type technologies, and not much penetration really with actually getting assistive technology into wide scale use of for supporting people with their care solutions. After some initial work at Worcestershire Telecare, really started to embark on the journey of outcomes-driven technology-enabled care. We started to plan that process and really start to raise the profile of assistive technology in Worcestershire. One of the ways that we did that was through a showcase facility that we developed and convinced it worked really, really well, really started to bring in local stakeholders and really start to share some of the knowledge around the potential for assistive technology devices and really start to highlight the use cases for those solutions. And this really started to gather pace. And working with commissioners and other key stakeholders, really able to look at the opportunities for employing assistive technology within care packages. We looked at this from a large scale perspective, but really delved deep into some of the cases that were presenting some pretty unique challenges for helping people to remain independent and healthy in their own home. So this developed and resulted in the launch of a large-scale tech service in November 2018, and it's really started to progress from there, and has been a huge success across Worcestershire. And I'll touch on some of the outcomes a bit later on in the presentation, but it really has come into its own during the pandemic as well. Having that embedded approach to technology-enabled care has resulted in Worcestershire being very well placed in terms of being able to react to some of the unique challenges around that pandemic. Next slide, please. So really what we started to do at Amica 24 was to really focus on how technology can enable people, looking at positive risk-taking and really adopting an approach which was the art of the possible. So not looking at things in a negative way and really focus on how you can enable someone. One of the ways that we did this was to look at all of the different solutions that were emerging and becoming available, really having a very broad and positive approach to that. So sourcing solutions from different parts of the world, really starting to look at startups and emerging providers of technology, not going for a one-size-fits-all approach. And this was very successful. So we saw solutions from right across the world. So you're seeing devices coming from China, from the States, across Europe as well. Mike mentioned around epilepsy, and we used very successfully a device that would detect seizures, tonic-clonic seizures, and really started to employ those technologies through trials and test cases, but then into the wider service as it developed. And these really were successful in delivering outcomes for people. And one of the key things that we did was really to engage with suppliers of products and the services around those products. So if we needed any changes made, or if through our experience we were able to make suggestions for developments, that was really important to our work. Next slide, please. I mentioned around avoiding a one-size-fits-all approach, and one of the key things with the emerging digital technologies in particular is that you're really able to tailor solutions for people, and really not just reacting to a situation where you have someone who's at risk of falls, for example, and giving them a fall detector, because if that's not the right device for them and isn't going to take into account the whole circumstances around that person, what their care and support network is, it's not going to be successful. And I think that what we had previously were some bad experiences with assistive technology, where a one-size-fits-all approach has been adopted, lots of devices just bought arbitrarily. And I think that, you know, the key difference that we achieved was being able to really focus the solutions to the individual. We also embedded a culture of technology-enabled care, really transforming people's perspectives on assistive technology and adopting a technology-first approach. And adult social care in Worcestershire, absolutely brilliant, actually changed their guidance for social workers to say, you know, we must be adopting a technology-first approach. We're going to talk about data quite a lot through these sessions, I would imagine, and that was absolutely fundamental to the work in Worcestershire, making sure that we were tracking the actual outcomes of the use of technology. You know, really kind of analysing and tracking the impacts that that it was making, and we used something called health independence and wellbeing outcomes tracking, a tool that we developed at AMCA24 to really track how the assistive technology was working for people and their support networks, what the actual people impacts of those solutions and technology-enabled care packages actually was. And we used quite specific health and well-being indicators and tracked that over a period of time, and also used lots of feedback from the service users themselves, the carers, care providers, families and social workers as part of a collaborative approach, employing our technology-enabled care coordinators. And fundamentally, we were able to change the perspective on assistive technology. And the way that we did that was by comprehensively tracking the savings and cost avoidance associated with those technology-enabled care packages. This was absolutely fundamental to our approach, and was one of the key reasons why we were able to achieve so much success with the service. And that's because people were no longer asking the question of, right, okay, so you've got this piece of assistive technology, how much does it cost? Which was what we always used to encounter. What we actually were able to do was change the conversation around assistive technology to how much does the assistive technology save and what are the impacts of it? And changing that mindset, changing that conversation around it was really, really crucial, because people started to understand where assistive technology could fit and where it could benefit and what the impacts were. And they've been seen over time. We were seeing it with individual cases, of course, helping people to remain independent in their own homes for longer, avoiding entry into residential care in particular. And because we're tracking all of this, we were able to do this in real time, and also be able to assess the success of the service over a long period of time. And since 2018, November 2018, it saved over £2.4 million worth of care costs. So that is, you know, a really amazing result, and really shows the financial impacts of it. But the people impacts have just been tremendous, and particularly during the pandemic, where people have been isolated, not connected with people, not connected with services, and really at risk. And some of the stories have really been heartening to experience as a service provider, where you're able to help people with really, really difficult circumstances and really challenging health conditions, etc., and being able to link them successfully through technology and to be able to get them the help that they need. Next slide, please. I've touched on using sourcing and using technologies and trying them out, and this was really fundamental to our approach. And what we were very successful in doing was to learn about people's individual circumstances and then share that information. We had some really, really significant challenges, particularly around dementia and the different presentations of dementia and cognitive impairment, and different accommodation options as well, and how that played a role in the types of technology solutions that we were sourcing. And it's just built up over time. We've been able to really highlight the proactive and preventative elements of technology-enabled care. So linking up stakeholder organisations and the actual procedures around services to benefit more from assistive technology. So how do you facilitate hospital discharge more successfully for someone? How can you alleviate pressure within another service through the use of assistive technology? And one of the ways that we've been able to do that is by information sharing and showing how you can use a GPS solution to enable someone to be discharged from hospital and go home and be in that safe environment. And if they are going outside, still looked after and be able to avoid those crisis moments. And sharing that information across multiple stakeholders has been absolutely vital to the success of the service. Next slide, please. I just wanted to touch on the future of technology-enabled care, and Mike alluded to it in his presentation clearly, and the potential with the emerging technologies and connectivity in particular, the 5G is really going to be a game changer, and high-speed broadband really overcoming some of those challenges that we face in rural counties in particular. But I think the potential for technology-enabled care is absolutely huge. And I think that it goes further than that. I think we're going to be moving to a situation where we're referring to it as technology-enabled healthcare. I think that we really should be looking at the way that we are delivering services out in the community from a health and care joint perspective, and making sure that those technologies are really placed at the heart of services and are delivering the impacts that they can achieve. And with the advent of artificial intelligence and the way that we can use big data as part of a whole population approach, I think that we're going to start to see bigger and bigger impacts all of the time through technology-enabled healthcare. And with the digital switchover happening and being completed by 2025, I think that we've got some huge potential there for having greater impacts. But we need to underpin that. We need to make sure that there are standards. We need to make sure that learning from services like ours in Worcestershire is shared, and that there is a national approach to this. It's very much in the news today, which is quite timely in terms of how we have a different vision for care going forward. And I think that some of the work that we've done and other examples around the country really need to be learned from. And that's everything from me. If you just flip to the last slide. Thank you very much. And if you'd like to find out more, then please do get in touch with me.
Thank you very much, Rupert. Again, flying the Worcestershire flag, which we make no apologies for, because, as I said, with BetaDen and the ecosystem we're building in this part of the world, you can see real practitioners, and should we say, a real addressing of this very critical issue for not just Worcestershire, for the planet as a whole. So thank you very much, Rupert, for your insight on that. Now I'd like to come to our third and final contributor for this event this morning, which is Smartbox Assistive Technology. Smartbox create technology for people who can't speak. Simon is going to introduce you to the challenges of creating that technology for a diverse range of disabilities. This is phenomenal technology being created, developed and delivered by a Worcestershire-based business. And as I said, immensely proud of Smartbox in this location, but you're going to hear for yourself now. So I'd like to introduce Simon Poole, Technical Director at Smartbox, and his demo entitled Giving People a Voice. Thank you.
Thanks, Linda. So Simon Poole, I work for Smartbox Assistive Technology. I look after product development, and we're based in Malvern and Bristol. So I want to start by introducing you to Tom. Tom is an 8-year-old boy. He's a very cheeky, happy 8-year-old boy. He lives at home with his mum and his dad and his golden retriever. And he has a very rare condition that affects his ability to communicate verbally. Now, his mum and his dad can often understand what he wants and needs because he can make sounds and he has facial expressions that he uses and he can communicate through those. But to you or me, we'd be stumped. We wouldn't know what Tom needs or wants. And he can understand everything that's going on around him, but he can't speak and he can't say what he wants, can't say what he thinks, and he certainly can't join in a conversation. So Tom needs technology to help him speak or to allow him to speak. We'll come back to Tom in a moment. So the field that we work in is called AAC. You may have heard of it. And AAC it represents the kind of tools and strategies, sometimes technology, sometimes not technology, but whatever tools and strategies people use to overcome their communication challenges. For Smartbox, this is mostly about communication devices. So the simplest form of communication device is what's known as a speech generating device. And this might be a tablet or an iPad, something like that, that you can use to type in and use a synthesized voice to speak. If we have a look at some famous people who use AAC devices, I wonder how many of these people you recognize. So the guy on the left, Rob, he is a former rugby league player, and he recently acquired motor neuron disease, I think a couple of years ago, and that's a progressive condition. So his condition's been worsening over time. He's lost his ability to speak, and he's lost his ability to use his legs and hands. So he uses an AAC device to speak. Lee Ridley in the middle, he's a stand-up comedian, also known as a Lost Voice guy, and he uses AAC in his stand-up act. Stephen Hawking, the interesting thing here is if you look at the little device, I don't know if that's clear, attached to his glasses, that is how Stephen Hawking speaks. He activates a switch with his cheek, and you may be thinking, how on earth has he written books and speeches and all the rest of it using a little switch attached to his cheek? But hopefully by the end of this presentation, you'll appreciate how that is possible. Just to give you a picture of the prevalence, these speech difficulties are much more common than a lot of people think. So 1 in 200 people could benefit from AAC. These aren't necessarily people who have completely lost the ability to speak. Maybe they have dysarthric speech, which means it's maybe very slurred or very difficult to understand. But you can see even common conditions like dementia and stroke can leave a certain number of people with speech difficulties. So that equates to around 350,000 people in the UK. The challenge for us as an AAC technology provider is that each of these conditions presents very different challenges because it's not just lack of speech, they come along with other disabilities. And it was interesting listening to Rupert's talk just now where he talked about moving away from one size fits all, and that is very much our philosophy. We talk about one size fits one, and everyone's needs are slightly different. And I want to talk you through like how we address that challenge of everyone's needs being different. So here's an example of some of the dynamics we have to think about in our products, different levels of ability. So the way I've positioned the slide is here. This might represent somebody with locked-in syndrome, which is quite an extreme form of disability, where they've got no motor control at all, and and no speech, but they're fully cognitive. They're able to listen to and understand what's going on around them. And they may be fully literate if they develop the condition later in life. Somebody else, maybe they've had a stroke, and maybe that's affected them in a bunch of different ways. Like it may have affected the language centers of the brain, their ability to understand and generate language, or it may have affected motor control, or it may have affected, the classic thing that people think of is the muscles around the face and making speech harder to understand. Or somebody may have a condition where actually it's progressing over time, and this would be an example, maybe motor neuron disease, but everyone would present differently with how it affects them. And so the challenge for us is, how do we deal with not just the loss of speech, but with all these other differing abilities? So how do we address this? We start with a speech generating device. This is the slide I just showed you before. And the most able people are able to type on a speech generating device and generate what they want to say. Lee Ridley is an example of one of these people, the lost voice guy. He's physically able. He uses an iPad with touch access, and you can see his device there next to him that he takes on stage with him to do his stand-up act. This chap is called Joe, and he's a Smartbox customer, and he's using one of our devices here. But you can see over his touch screen, there's another picture which probably demonstrates it a little bit better. Over his touch screen, he has this plastic grid, and this is because Joe lacks precise motor control. So he can use a touch screen, but he can't use it precisely enough to touch small buttons correctly. And these plastic ridges help stop him accidentally moving his finger onto the wrong button, which is great. It means you can use our devices really well. But imagine for a moment if Joe wants to access websites or apps. Using a website or an app without fine motor control can be extremely challenging. And that's one of the things that our technology has to do. It has to adapt those apps and websites to make them usable for him. And in a moment, I'm going to just demo briefly to you how that works. This amazing lady has too much involuntary muscle movement to use a touchscreen, even with a key guard. So she uses an eye tracker, which I've kind of drawn a red line around so you can see where it is on her device. So she controls the device with her eyes. It's using infrared technology to scan the position of her pupils, and she just has to look where she wants to click and linger her gaze on that, and it clicks. We have eye tracker technology now that can cope with quite big involuntary movements of the body and head and still be able to keep a stable eye tracking on the screen, which works really well for her. This lady is called Lucia, and I've got a little video here. So Lucia, let me just pause it there. Lucia uses a foot switch to access her device, which is basically a big button. So one big button, and she's able to type with that button. And this is working in a very similar way to Stephen Hawking with his cheek switch. So what's going to happen as I progress this video, she wants to write the word getting, and she's going to click her switch to scan down to the row with the letter G in it, and then click again to scan across to the letter G. So there you go. She goes to the G. She'll do the same to get to the letter E. And by the time she gets to the letter E, getting shows up in her suggestions, and she can just click across and hit the word getting. So that is how she speaks. And I think it'll move now to a shot where you can see her foot switch. Foot switches, so a switch would be used by somebody who can't use eye gaze accurately enough or quickly enough, or maybe they just get fatigue or eye strain from using it over long periods of time, and a switch just works better for them. And it's very much down to someone's individual condition. So you can see the big switch she uses with her foot. Right, so I just want to show you our software. So we call it Grid. It's our main software product. And I want to show you the kind of adjustments we make for people with these different technologies. So this is a keyboard that's designed specifically for switch users. And what you'll notice here that the letters are not in the standard QWERTY order. They're ranked by frequency, but not frequency of how often they appear in the English language. We've adapted it because we use predictions, and most of the time you want people to use these predictions on the left-hand side. So it's the letters based on how frequently they appear at the start of words. So if I wanted to write in here, this is how I speak, and hopefully you might hear it as I type.
This. is how I speak. This is how I speak.
So you can see that the predictions are really important for achieving a decent rate of speech. So how do we help Joe with his need to access the internet and apps? So what we do is we take something like Spotify. Let me just get into the Spotify app. And we show the app on the screen, and we wrap it with accessible buttons. And you can use either a device with a key guard by touch, or even eye gaze if you use eye gaze but you're not super precise with your eye gaze positioning, or somebody like Lucia who uses a foot switch. She can now use Spotify. You can see as I mouse over these on the right is selecting items on the left, and I can go to browse and look at what's in the charts, and this makes and I can get back to all the actual play and next previous controls. And that makes Spotify accessible for people like Lucia to use. We have a bunch of other apps in there you might have seen, things like WhatsApp, Spotify, Facebook, YouTube. And then we also provide an accessible web browser, which wraps your web page in, again, accessible buttons that can be used via a switch. And you can use these to navigate around the web page and click on links. So let me just go back to Tom, who I showed you at the beginning. So Tom's 8 years old in this picture, remember. He first started using an AAC device when he was 5. But of course, Tom couldn't read or write when he was 5. And this is a common problem for many AAC users. Some of our users acquire a condition later in life. So people with MND is a classic example, and they're fully literate and they're able to use a keyboard and a computer. They know how to do that, and text prediction and autocomplete, and they can get going. Other users like Tom, who are born with their condition, have usually not learned to read or write, but still need to be able to speak. So the solution for this is called symbol-based vocabularies, and I'm going to show you an example of that. So Tom would have started with something like the SuperCore learning grid, which is so let me show you. So it's a 12-cell grid of buttons, because when he started, he would have had very low accuracy with his eye gaze. He would have had to learn to use it precisely. And his communication partner or carer or his mum would pick a theme based on what they're currently doing. So maybe the eat and drink theme. And he would be presented with these symbols. He wouldn't be able to read the words, but his mum can teach him to associate these symbols with the sounds. If I click on want, he can learn that image represents the word want, and then he can start to form simple phrases like want biscuit.
Want biscuit.
He would then progress as he becomes more used to this onto a grid with more cells that lets him express a little bit more. And then ultimately he would move on to a full vocabulary. So this grid has the left-hand side, left 2/3 is what we call core vocabulary. These are words you use really frequently in everyday life. And then you can access things like extra words regarding position, or I could access things to do with education and get extra words in there. And I've got down the bottom, I've got adjectives, verbs, questions, and more words to do with people. So if I wanted to say, this is how I speak on a grid like this, I'd be learning what the symbols mean, and I'd be going, this
is how I speak. This is how I speak.
You can imagine that's a fairly slow process and it takes some time to learn, but actually people do become quite effective with it over time. So final slide really is just to say, like, our two kind of key challenges. Well, there are many challenges we're trying to address, but two ones of particular interest I want to call out. One is access to AAC. If you think about all those different conditions that I showed at the start where AAC would be valuable, there's only really a small number of those conditions where there is knowledge about AAC in place and funding in place for people to get access to AAC devices. And a lot of people who would benefit from it really don't have access because the care professionals working with them don't have the knowledge of AAC to know what difference it could make to them, or the funding pipelines aren't in place. So access is one thing, and we're working on that. We're going to be looking at dementia in particular in the next year to see what we can do in that space. And then the bottom numbers, WPM means words per minute, and this is talking about speech rate. So on the left, we have the typical speech rate of somebody using an AAC device, and on the right, we have a typical speech rate that I would speak at, for example. And you can immediately imagine how these devices, they're amazing in terms of what they unlock, in terms of people being able to express their wants and needs and talk to people and write documents and etc. There have been several autobiographies written using AAC devices. But in terms of participating in a conversation with a group of people, it's not there yet, and there's a long way to go. So that's it, really, and it shows you kind of a summary of our space and what we're working on.
All I can say is, wow. I hope the audience is as blown away as we are as a team about Smartbox and the amazing technology that you are creating and are delivering on. So thank you so much, Simon. Absolutely right at the core of that very, very challenging topic. And now from an AAC point of view, as you said, that knowledge share, you can see, as you've explained, that gap that needs to be filled. So as I said, Smartbox, well done, and thank you so much for supporting our event today. Okay, that concludes the presentation part of our session today, but we're now going to do a very short Q&A with our panel of speakers. And as I said, please keep any questions coming through that you feel you'd like to address either to one of the presenters today, or to a more general kind of question to all three. So if we could open that, we have had a question in from Nick Comley about bandwidth. And again, I appreciate this is not the topic of this conversation, but all of this technology will not work without the relative requirement for that bandwidth. So I think for Worcestershire, and I can say, as part of the jigsaw of innovation and technology development in Worcestershire, BetaDen is co-located with Worcestershire's 5G testbed test and evaluation service called NextG Works. It's now become a commercial entity. There is a lot of investment going in, but also this rural 5G story is something that, again, as you said, from the Amica 24, what Mike alluded to as well, with some of the pilots going on, this is all work in progress. But would any of the panel like to kind of just give some feedback around that bandwidth question? And I think some of the solutions that we could be looking to enhance in this locality through this improved bandwidth requirement. So who would like to take that question? I'm going to push it out to you, Simon, because you're a tech director. So can I push it to you from a bandwidth and how Smartbox has to engage as delivery on this?
Well, so interestingly, we've made the decision so far with our technology to ensure it works entirely without internet when it needs to in terms of voice. And that does actually present some limitations to us. So for example, all our speech synthesis, the generated voices, you're probably familiar with what generated synthesized speech sounds like. There is new technology coming out which gives a much higher quality voice sound, and Amazon and Google and people like that have been investing heavily in it. But it's currently cloud-based. You can't run it efficiently on an end-user device. And we have dilemmas like, do we introduce this much more expressive kind of voice and which will let us have much more individuality in terms of choice of voices you can have, with the downside that it would have to degrade if you lost your internet connection. And those are the kind of things we're going to have to think of, because you can't, no matter what you do, if somebody's out with a mobile device, you can't guarantee it.
Okay, thanks, Simon. Anybody else? Mike, would you like to come in there? Sorry, you're on mute. Could you unmute yourself, Mike? We've lost your sound. So sorry. Rupert, did you want to comment on that?
Yeah, absolutely. I think it's a really important question that Nick has raised around it, and I've had direct experience with this challenge. It's really clear that 5G is going to be a game changer. the level of data that you're going to be able to transfer, and the increasing use of video technology is immense. The potential there, and that's been really highlighted during the pandemic. Been doing some work really focused around loneliness and isolation, and using tablet technology to connect people up, and that's been really successful. And I think that 5G is going to be a complete game changer there. But in terms of those lower grade networks, I think that we've got to look at the potential for the use of those. In particular, I know, being from Herefordshire and some of the real challenges around mobile phone signal in Herefordshire in particular, there are some real black spots. And the crucial thing is that we're making sure that people aren't excluded from the solutions that are on offer. So we may need to be very dynamic in the way that we use different networks, but very much make best use of local hubs, and facilitating connectivity through those means, I think is going to be crucial going forwards.
Yeah, sorry, and just to Nick came back very quickly. There is how long will it take to get isolated rural communities connected? And I think this again with low subscriber numbers, it is a real challenge. I appreciate this is not what this presentation today is about, but just a quick answer from one of the panel, please, on that.
Can you hear me now?
Yeah,
Linda?
We've got you now, Mike. Right. Go for it.
So I'm in Hereford, and one of my challenges is connectivity, as we've discovered this morning.
Yes.
One of the reasons for us bidding very much for the wider rural 5G pilot, which is focused on health and social care use cases, was to start to try and demonstrate to the Treasury that their Green Book use cases have to consider the greater social value as well. So in answer to Nick's question, that's what we're trying to do via both our Tenbury and Malvern pilots. But the other thing I'm trying to work with local authorities on with something called Satellite Catapult UK is trialling some initiatives that we can establish connectivity via the low Earth orbit network that the Bonneville and Elon Musk is rolling out. And I think that's probably some of the black spots that we talk about may be where we have to, focus in the short term. There are some challenges around the big telecoms providers are reluctant to invest in rural communities, but I think there are ways we could do it. And if we look at the low Earth orbit satellites, maybe we can use some of those community assets like village halls and so forth that Nick and Community First are involved with, to make those hubs that we could utilise with those connectivity. So would happily explore that with Nick and Community First colleagues.
Thank you. Thanks so much. Okay, let's move on to another question now, if I may. Rick Leach from Callisto Life Science Partners has asked the question, what is being done to streamline the access points to decision makers and stakeholders for such technologies? It seems there's no standardized market access protocol for such tech that makes national adoption difficult. This is probably something I either want to, I'm coming to you, Simon, again, from a delivery point of view. What's your take on this?
So I think in the AAC market, the established AAC market is not too much of a problem. So in the UK, for example, there are NHS hubs that specialize in AAC. And if you're in the area of one of these hubs, then you have access to the specialized support you need to get access to technology. Or you go to direct to technology providers, and they're very good at signposting people. I think the challenge for us particularly is more in other countries where there isn't this established understanding of AAC, and we can't just launch a device and a sales team in a market. The whole infrastructure of funding and support has to develop along with it. That is something we're thinking about, how we might start to do that in other countries.
Thanks. Rupert, did you want to comment on that?
Yeah, endorse what Simon was saying there, and I think it links to another question that we've got within the chat as well, from Matt Richards, around how do people get a better understanding of the value of a solution for longer in their life, and that links through to people's access to information around assistive technology. We've still got a lot of work to do in the UK. We've talked very much today around health and social care, but we must be really embracing the self-funder marketplace around assistive technology, because the key thing with assistive technology is getting it in place as early as you possibly can. And one of the ideas that we've talked about very much here in Worcestershire has been around people's life curve. So how do you manage the progression of their conditions over a longer period of time, and that from an individual perspective. But then when you transpose that to a whole population approach, that's when you start to realise the significant impacts. And one of the key roles that the Tech Services Association is going to play is in terms of standards and information that is going to be available for people to make sure that they can access the real benefits of assistive technology. So how do they get referred? How do they get funding? How do they get information about these products and solutions? So that's going to be critical going forwards.
I was going to say it isn't early in the market, I know, for some of the larger enterprise businesses, but for SMEs and for some of our, as I said, early stage technology businesses and how they enter this market, it's a big challenge. And I think, for Matthew Richards, CEO of Steertide, they have to make it real, that commercial entry point for the marketplace. Yes, it's wonderful about the amount of innovation, but I think perhaps both from Amica and from Smartbox's view, as businesses that have grown and are growing and developing in this space, it's the cost, isn't it? And how you get this to market. And as you said, all of the policy making and that kind of evangelizing about this is, again, it has a cost to it. And it's the route to market angle, and the affordability is a big challenge on that. And I think that leads into a question from Derek Willins of Advent about security, and they're a security company, Advent IM, and a question around the assurance or technology. And he said he's nervous about the amount of personal data that gets collected and shared amongst multiple stakeholders. Is enough attention being given to security? Simon, would you mind once again picking this up first?
So we're very conservative about it in Smartbox. We collect as little data as possible, and we fully anonymize it from our devices, but we have to have data about how our devices are used, so we know what people, as you saw when I demonstrated the software, there are loads of features I didn't show you. We need to know what's being used to know where to direct investment. So the data is critical for us to make sure we're doing the right things. Obviously, we would like to do things. We talk about, for example, how do you help an AAC user progress with their literacy or with their AAC skills, and how do you help their speech and language therapist with that problem? Like, they want to know how the user is using the device when they're not around, and all those kind of things. We're not currently doing that, collecting data to give the speech and language therapist, but you can immediately see there are benefits and risks to that. It's not an easy decision that we would just walk into without a lot of serious thought.
And Rupert, the security question, if I may.
Yes, I think it's an absolute key concern. There's the advantages of sharing information, but there's the risk. And I think central to this is standards. Again, we must have very rigorous standards that are in place, and Tech Services Association is developing a set of cyber and information security standards around assistive technology use, because that needs to be fully understood as we move forward to creating this infrastructure that we all want to get to, because the benefits are huge, but we need to make sure that we're protecting people's privacy at all times, and that they really understand how their information is going to be used and how it's going to benefit them.
And I think I'm going to come to, as I said, we're nearly at 70 minutes and we're going to have to wrap this very soon. But I think I'm going to come to Mike for the final word, as you know, in his very strategic role as Director of Digital Health for Worcestershire and Herefordshire. We've heard the rural challenges. We, I think, as a Worcestershire representative, you know, and the work we do in our accelerator program in BetaDen. And we'll be opening recruitment for cohort 5 later this autumn. You know, the kinds of businesses that can work in this space and be part of this growing community, I think, is really important. And as I said, with such strong advocates like Amica24 and Smartbox, doing this here is testament to you can do this, and you can. As I said, I know that Smartbox have done a recent, they've got an investment into the business. So, you know, this is, again, strengthening that story as you go further into market. But Mike, may I come to you for a final kind of wrap on this from this very, very interesting topic for today's BetaDen Tech Tuesday?
Thank you, Linda. My quick reflections are, one, it's as an NHS and a local NHS organisation, actually one of our other priorities is around working with partners around economic development and working with industry. And I think it is very evident today that you've heard from 2 organisations that really are leading the way on this, but also have the opportunity to work with the NHS going forward. And we really can do some really interesting stuff. I think nationally, it's important to remember that this is right at the top of the agenda of the health and care sector. NHSX are looking to invest monies into startups, but also existing organisations to commission initiatives. So there is a way into the market by working with partners across the sector, which is very, very exciting, and working with people like Rupert on the standards as well, which is underway nationally. So I think huge opportunities for all. And then, as I put in the chat, I will just end on the personal note. I know the benefits of this for individuals, my daughter in particular. I've got to declare a conflict of interest, but Smartbox has made a huge difference to me personally, and I know what remote monitoring can do, and assistive technologies. And we have an incredible opportunity to work together on that across Hereford and Worcester. Let's be at the forefront of it.
Absolutely. Thanks, Mike. So I hope you've all enjoyed today's presentations, and I hope it's given you plenty of food for thought in both technology application, challenges around it, and all of the, should we say, digital connectivity that makes, should we say, some of Worcestershire's focus now, particularly in the 5G and beyond investment, even more pertinent. So we close with a reminder that BetaDen's Tech Tuesday series continues, and we'll wrap the end of this year's broadcast on the 7th of December with a topic title of Global Technologies for the Next 5 Years. And we plan to have 3 leading keynotes from technology leaders for that. Sticking to strategic sectors for Worcestershire, I would stress, but certainly please don't miss that one. Make a note in your diaries and register. More on the speakers available for that, and should we say how we're going to cover that coming later in the autumn. We look forward to seeing some of you at some of our future events that we'll be planning, hopefully, to get some more physical delivery online from our base at Malvern Hills Science Park. And the other local event, if you are local, is we're part of Malvern Festival of Innovation on the 7th of October, Thursday, the 7th of October. We're going to take place in an afternoon event at Malvern Theatres called Innovation on the Hills. Some of BetaDen alumni companies, a very mixed technology network at the moment, but some very interesting, everything from cybersecurity, AI, autonomous vehicles. and some edge computing solutions. So if you'd like to come and meet some of them and some additional tech entrepreneurs, the afternoon of the 7th of October at Malvern Theatres. It's a floor walk, no big pressure, but if you'd like to come and meet some of these companies and hear about some of their tech, please join us then. But I just would like to end to say thank you to Mike, Rupert and Simon today for supporting BetaDen with this Tech Tuesday and this immense topic, and let the journey continue. And as I said, thank you for all the work you do in this area. Okay, and thank you to our audience for joining us, and please spread the word. The next Tech Tuesday, 7th of December. Thank you. Bye-bye all.